Thank you, Mr. Speaker. Colleagues, today I rise against Senate Bill 1, and I encourage everyone in this chamber to take just a few minutes, and I promise a few minutes, to think about the long-term positive impact we could have on our children's health by voting no. This bill allows the prohibition against requiring proof of COVID vaccination to stand, not just this year, but permanently. And as we mark the second anniversary of the U.S. COVID-19 vaccination campaign, understanding the impact of vaccines on reducing disease burden is needed to inform our future evidence-based action on this bill today. It has been almost 2.5 years since the first COVID vaccine was given in the U.S., and since then, listen to this, y'all, we have administered more than 655 million doses. 80% of the population has received at least one dose, with the cumulative effect of preventing more than 18 million additional hospitalizations. 18 million hospitalizations were prevented, and more than 3 million additional deaths. In early 2021, when the COVID vaccines were widely distributed, there was a huge demand. We remember it, right? At the peak of the vaccination campaign, 4 million people got vaccinated in one day. That demand dropped off by the summer, and 2 years later, many states are still barely north of 50% of people fully vaccinated, including in Georgia. So how many lives would have been saved if that slump in vaccine demand had never happened? Have you ever wondered about this? To answer that question, Brown University and Microsoft researchers calculated the peak vaccination rate for each state, and then imagined that that rate continued until all adults in the state were fully vaccinated. The total for the country is stark. Yes, many of the nearly 1 million COVID deaths took place in 2020 before vaccines. But from December 2020 through November 2022, these researchers estimate that the COVID vaccination program could have prevented more than 18.5 million additional hospitalizations and 3.2 million additional deaths. Without vaccination, there would have been nearly 120 million more COVID-19 infections. The vaccination program also saved the U.S. $1.15 trillion in medical costs. And these numbers are even more striking in certain states where more than half of the deaths could have been avoided. Half of the deaths could have been avoided. In Georgia, at least 13,000 deaths could have been averted by vaccination, according to that research. So in addition to tying our hands to prevent ongoing illness, it is worth noting the trends of declining COVID vaccination rates, as others have shared, are increasingly spilling over into other routine immunizations. Did y'all know that Georgia is the 4th least vaccinated state in the nation? Number 1 for business, but number 48th for vaccination rates. And that's for all vaccinations, not just COVID. And studies have found that Georgia ranks in the bottom for vaccine rates for our children, for flu, 47th for adults for flu, and 42nd for the number of adults even vaccinated for tetanus. These trends began before the pandemic, and our historically low rates are worsening. According to the new data from CDC that shows the percentage of U.S. children entering kindergarten, their required immunizations fell to 93% in 2022, 2 percentage points below the recommended herd immunity levels of 95%, and lower even still than vaccination rates in 2021. And while 1 or 2 percentage points might not seem concerning, 1% represents tens of thousands of people, children, who may be inadequately protected from diseases we can easily prevent through immunization. These trends are alarming, both for our health and our finances. The CDC estimated that vaccinating children born from 1994 to 2018 would prevent 472 million illnesses. That's why we're talking about this. It would prevent nearly 30 million hospitalizations and more than 1 million deaths The state-run vaccination requirements are also projected to save $479 billion in healthcare costs and other related costs. Our unvaccinated are at great risk because the disease vaccines prevent have few effective treatments. Even in this day of great medical advances, children who are unvaccinated are not protected against the suffering, the complications, and the long-term disability that can come from vaccine-preventable diseases. And one last thought. Everyone in this chamber who cheers "Go Dogs" after every single prayer, just know that we personally benefited from required proof of vaccinations for measles, mumps, rubella, chickenpox, tetanus, hepatitis B, TB. Why in the world are we going to be denying these same protections for students? All of this comes down to trust. Whether our political leadership creates the climate of trust in the public health agency's efforts, in the science, in the ability of our healthcare system to deliver. This is not about discrimination. It is, in fact, about the health of all Georgians. And for all of these reasons, I ask you to please seriously consider voting no on this bill. Thank you, Mr. Speaker. I yield the well.